Hi, everyone. Welcome to today's Career or Talking Tour. I'm Krista Harmon. I'm from the Kent Intermediate School District, and I'm one of the career readiness consultants. And we are thrilled to have Mary Freebed professionals as our career mentors today. So thank you for joining us, everyone. I'm going to move to our next slide. And to start off, I'm going to have you guys introduce yourselves. I want to know your name, obviously what your job is at Mary Freebed, and how long you've been with them. So just those three things: your name, your career, occupational title, and how long you've been with them. And Chris, you can start, please.
Sure. Okay. My name is Chris Boer. I'm a physical therapist here. I am the therapy team lead for the medically complex team. I've been with Mary Freebed for probably about 10 years in 2 different positions.
Good. And I look forward to hearing what a medically complex team is all about. Thank you for being here. Hi, Jeannette. Good to have you back. Can you share with us next? And unmute yourself.
I should know better. Good afternoon. I'm Jeannette, the Director of Interprofessional Education here at Mary Freebed. I started restoring hope and freedom through rehabilitation care and education in January of 2017.
We're so glad you're here. Thank you. And hi, Stephen. Welcome.
Hey, I'm Steve. I am the Orthotics and Prosthetics resident currently in the Lansing branch of Mary Freebed, and I started in July this year, and the residency will take me through July of next year. It's a 2-year residency, one for each orthotics and prosthetics.
Great. And I know a lot of young people may not know what this is about, so I'm super excited that you're here to share. And Dr. Donders, welcome. Could you share a little bit?
Sure. I'm Dr. Jacobus Donders. I'm the head of the psychology department, and I've been here longer than most of you are alive. It's more than 30 years.
We're glad you're here. Thank you for making time. And Dr. Donders is going to have to leave in about 30 minutes. So I'm going to start with you, Dr. Donders. I know it's 30 years ago or plus, think back to when you were in high school. Is this what you thought you'd want to do? Did you think you'd want to be a psychologist back when you were 16 or 17, like some of these young people? Share us that initial thought pattern and how you got to where you are, just briefly, that quick career path.
Well, when I was very young, I wanted to be a carpenter, but I learned quickly that I was too clumsy for that. And when I was in my senior year of high school, I was primarily interested in what makes people do things, what makes them move, what makes them tick. And at first, I thought my career was going to be making fancy commercials and convincing people to buy stuff that they didn't need or something like that. But eventually, I got interested in healthcare, and that's how I ended up in rehabilitation.
Awesome. So we'll look forward to hearing more about your career. Thank you so much. Stephen, what were you thinking back in high school? I know it's not as long ago for you.
Yeah, in high school, I knew I kind of wanted to do something with the human body in the medical field, but I did not even know about orthotics or prosthetics even existed in high school. Didn't know what those words meant. I went to college initially for physical therapy and learned about the field in my sophomore year of college, and it kind of went from there.
Great. I know our next question will be for you to share what it's all about, what ONP is. So thank you. So you didn't know when you were in high school, and kind of just, well, did someone specifically talk about it? Did you read about it? Kind of what piqued your interest, or how'd you even learn?
Yeah, I guess I kind of read about it. It was just, I was at a meeting with my academic advisor in college, and we were going through certain career paths to take with the undergraduate of kinesiology. And this was on that list, and I had never heard of it. And so I shadowed a place in Lansing a few times, and I really liked it and just went on from there.
Awesome. Good. Thank you for sharing that. Jeannette, when you were in high school, did you think you'd be a nurse?
I wanted to be a nurse, but my circumstances didn't allow for me to be a nurse. I actually was asked by my family to work early on to bring home an income, and I started out in finance. I fell into nursing actually in my 30s. So nursing is truly my second life, my second career. And I feel very privileged now to serve in this capacity.
Yeah, and I do want you to share just a little more about that, because I want young people to understand that this is a journey we're on. And sometimes things don't work out the way we wanted right out of high school, that you can change careers, that it's not just one thing you choose and you're with it the rest of your life. Just tell us a little bit what you did before you became a nurse at 30.
I was actually working in the financial world. I started out in Germany, worked for tax consultants after high school graduation, and liked that work a lot. And I needed to learn English because in Europe, most people, when they work between different countries, they speak English. And so I came to the United States to study English. And it happens that I fell in love with my husband. And 30 plus years later, I'm still like Dr. Donders. Here's that 30 number. I'm still married to the same person. And because I had started out in finance, that's what I did in my early years of marriage. I worked in financial institutions, and then one day we had children. Then I worked a little bit less for a while, and then my husband was on the verge of losing employment, and he said to me, "Hey, Jeannette, it's time to go back to work full time this time. What are we going to do? We're facing some challenges." And I looked at job openings, and I knew I would work nights. And the only opening at nights in the Grand Rapids area was actually at a local hospital. And I said, fine, I can do this. I can work 3 12-hour shifts, carry some benefits, contribute to income. I started working as a nurse tech in the Butterworth emergency department and fell in love with nursing beyond return. 6 months later, I started enrolling into classes. And in 2006, when my son went to first grade, I went to nursing school, and 2 years later graduated with my 2-year degree. After that, with my 4-year degree. Then shortly thereafter with my master's. And last year I graduated with my doctorate in nursing. So a very different career path than ever anticipated.
And congratulations on your PhD. That's new since I've spoken with you. That's terrific. Thank you for sharing that. And I want young people to hear that, you know, she started as a nurse tech after a career in finance. So again, we aren't stuck with this decision. A lot of young people feel that pressure, you know, to have it all figured out. You don't need to. So Chris, physical therapy, what did you know about this in high school? Was this something you'd always dreamed of, or how did that evolve?
No, I didn't really know much about physical therapy. I was pretty sure that I wanted to do something in the medical field. I grew up in North Carolina, and there was a program there that I was with some other high school students, and I had some exposure to physical therapy through that. We got tours in the hospital, and actually got a tour of the morgue, which was pretty interesting. But kind of that was the first encounter I really had with physical therapy. I was pretty convinced that I wanted to go into medicine. And you know, that didn't quite work out as well as what I had thought. It wasn't exactly what I was looking for, and realized that the physical therapy really gave a lot of the opportunities to have those great relationships with patients and work in a healthcare setting and spending a lot of time with patients. And so it just became a great fit. And so, yeah, I didn't really decide physical therapy until after I was done with college. Just sort of like Steve, wasn't quite exactly sure where to go, and kind of got some advice, and that kind of that door kind of opened up.
And that's what I'll look forward to this time with you guys in this next, 45 minutes, is give that advice that can maybe help expedite something along the way for one of these young people. We'll see. So Dr. Donders, a lot of young people might, let's kind of go into a little bit what some of your jobs are, because they may not be familiar with what it is. So psychologist, a lot of us might assume, it's helping people with mental health, but how does this apply to Mary Free Bed? Why do we need a psychologist there? And so tell us what it is and why is it needed at Mary Free Bed?
Sure. So many of our patients have had a catastrophic event happen to them, whether that's a stroke or a spinal cord injury or a traumatic brain injury. And they understandably have emotional reactions to that. If you're paralyzed on one side of the body, or if you're paralyzed all the way from the waist down, you can't move anymore. That can understandably be depressing. I see a lot of elderly patients on an outpatient basis who note age-related cognitive decline or something more serious, the beginning of Alzheimer's disease, and they have thoughts that they might be better off dead. Well, how do you help them cope with that change or that adversity they have in their life? That's one thing that we do. The other thing that we do a lot is evaluating people for problems that have resulted from something that happened to them, and how does that affect their ability to go back to work or to school. For example, let's say you've had a concussion or a severe traumatic brain injury. Can you still drive? Can you still do a job where there's safety issues? Can you still do a job where there's troubleshooting? That requires certain tests. That's another thing that we do.
Well, obviously a real critical part of the care team as the psychologist. And I know, I see Stephen kind of nodding his head, like, yeah, when you have such a life-changing event, there's so much emotional going with it. So thank you for that. let's see, Jeannette next. Or actually, it was Stephen next. Tell us what an O&P is, and even what a resident is. I don't think everyone might understand what that is too, Stephen.
So O&P, orthotics and prosthetics, it's two things. With prosthetics, it's when we make a device for somebody who's undergone an amputation of a limb of their body, whether it's an arm, leg, it can be multiple parts. That device we make for them to walk again or to have an arm again, that's a prosthetic. Whereas if someone has a pathology with their body that they still have their body parts, but it's not working correctly, it's orthotics is bracing and working with that body part to get it to function better, properly than what it is with the pathology. And then what is the next question?
Oh, what a resident even is.
A resident is, so in orthotics and prosthetics, it's a master's degree, and then which is just 2 years. And then after you graduate, you have to complete a 2-year residency, 1 year of each orthotics and then prosthetics in order to be certified as a prosthetist or an orthotist.
So young people, I just want you to understand that there's levels of this education. We're going to dig into a little bit, but he's still in training. And so that's what a resident's all about too. So thank you for sharing that, Stephen. And again, O&P, you guys, a lot of you young people just learned a new term. So Jeannette, as far as nursing, give us a little explanation of what nursing at a rehabilitation hospital is versus maybe what we see on TV as far as some of the acute care, for example.
So when most people think about nursing in a rehabilitation hospital, they think, is this really nursing? And I actually came in with that thought process to the organization, not realizing how very complex nursing is. When you come to rehabilitation nursing, you actually get double bang for the buck. You're going to have to be able to think like a med surg nurse, because a patient who comes into our setting could come with underlying disease issues, diabetes, heart failure, you name it. So you're managing on a med surg level for sure that piece of care as well. Because when rehabilitation takes place, the other diseases don't go away. They are still part of that patient's picture. So here is the double bang for the buck part. Not just do you function like a med surg nurse, but you also need to understand the components that are related to rehabilitation care. So you're actually double equipped as a nurse. And in most TV shows, nobody would ever show you this, but the truth is you have to be able to stand on both legs in order to really give adequate and competent care to patients, managing underlying disease issues and addressing rehab. You are incredibly qualified. And in our organization, after 3 years, we require certification in our line of work. So we actually take pride in providing care and making our care providers the most excellent people in nursing care that they can be.
That's a great explanation. And just to help the young people that might be on the call, what is Med Surg? Can you just give a quick definition of what that might mean?
In medical surgical nursing, those are in most cases your general diseases that patients face. So for example, if I have congestive heart failure, diabetes, those kind of diseases are normally treated on a medical surgical unit in an acute care hospital. But when we come to rehab, like I said, those disease components do not stop. They're still part of your care picture. So we need to be able to manage that piece, recognize acute phases, meaning when somebody all of a sudden responds outside of the norm of the disease. So we have to have that acute care knowledge plus that rehab knowledge. That makes us extremely valuable members of the care team. We're doubly equipped to serve you.
Thank you so much. And, Chris, help us understand what physical therapy is. And as you're sharing, if you don't mind slipping in just a little bit of comparison of what a PT is versus an OT, an occupational therapist, because some young people are maybe wondering what the difference is.
Sure. So I'm a physical therapist, and as you asked earlier, what is the medically complex team? So the group of therapists that I work with, we take care of patients who have had primarily a cardiovascular or pulmonary issues, which would be heart disease, lung disease. We see patients that have been on the ventilator. We're primarily taking care of the really sick patients that we're seeing that are having COVID. And a lot of the weakness that they have. Another area that we also would be treating would be patients that have Parkinson's or just some general weakness patients that may be due to age or maybe due to a fall or something like that. There are other teams in the hospital, and those teams would be pediatrics, taking care of kids. We have a team that takes care of spinal cord injury patients. We have a team that takes care of patients that have had a stroke, and then we have a team that takes care of patients that are primarily brain injury. And each team is composed of physical therapists, occupational therapists, and speech therapists. In addition, both PT and OT have assistants. So we have what would be a physical therapy assistant, and the other option for OTs would be a certified occupational therapy assistant. Those assistant positions are typically a 2-year program after high school, where they do get some very, very condensed training, and then they would work with us as part of the team. Primarily what I am doing is, as a physical therapist, is working on improving patients' strength, their balance. I'm working on improving their ability to walk and to transfer, getting up and down stairs. Where an occupational therapist would be working a lot on how patients are doing getting themselves dressed and how they're working on managing themselves in the bathroom or making meals and getting ready to do things out in the community. And then a speech therapist would be working on swallowing and would be working on just voice production to help us hear the patients as well. So we work together as a team. At Mary Free Bed, all of our patients receive 3 hours of therapy every day during the week. So five days of therapy every week. And that's a combination of PT, OT, and speech. So we really keep our patients pretty busy, and that keeps us busy working for a half hour or an hour with each patient throughout the day.
Thank you, thank you so much for that. Just really good, kind of comprehensive look at what's happening there behind the scenes. That it takes so many of you, including stopping in on Dr. Donders, right, as part of their treatment as well.
Correct.
Now, Jeannette, are you still on here, or did you have to leave yet?
I will stay the whole time.
Oh, you already able to stay. Okay, great. So I'm going to go back to Dr. Donders because he has to leave in just a few minutes. So when we think about psychology, if there's students on the call who think I'd really like to help with that side of it, versus the direct clinical care that might use that little slight difference with the kind of socio-emotional health, what would be the education for them? And are there steps that they could be doing in high school or college to kind of help get them to that next place?
Sure. Yeah. College preparation can be diverse. Some people do a pre-med course, some people do more humanities. Most graduate schools, you want to always look for a school that's accredited. To practice psychology in the state of Michigan, it does require a doctoral level of education. So after college, you do need to get a master's and then a doctorate. In the specialty fields like neuropsychology, which has to do with brain-behavior relationships, which is what I do, you don't need to do a 2-year postdoctoral residency. So you're probably going to be in your late 20s when you start. It's worth it. I love what I'm doing. My wife has told me that she's going to retire next year. I have no intention of retiring anytime soon.
Well, I know that that's kind of a gift to be able to pursue that level of education, those extra years. I think not everyone's gifted with that push and desire and motivation. So I really admire people who do that. Thank you for sharing that. I know that for you, Stephen, we wanted to get a little bit into your education. Some young people are wondering about what type of internship maybe was needed as undergrad. And I also want you to help them understand that it doesn't matter what that first 4-year degree is. Help their young people understand there's a little flexibility there.
Yeah, there's a lot of flexibility. So it is a master's, so you have to get a bachelor's degree before in 4 years of college. But what that's in could be a lot of different things. Mine is in kinesiology, and I would say that's a pretty common one for ONP, but I would say the other extremely common one is engineers. So people that really didn't have anything to do in the medical field, but what they did is they were like an engineer bachelor's, and then there are prerequisite classes you have to take to get into a master's program, and then they will take those as long with their engineer degree and get in. So it's a lot of different, and there's even more than just engineering. I don't know the other ones on the top of my head, but I say, yeah, it varies greatly.
Yeah, it could be a biology degree or a health sciences degree. There's just a bunch of different things. Like you said, it's that prereq that you need to get some of those
Yep.
classes under your belt, but there's flexibility, which I want young people to hear, because again, there's just a lot of pressure to have it all figured out right now. Jeannette, as far as nursing though, that tends to be a 4-year degree. I know there are 2-year programs. I think even Grand Rapids Community College has it, a 2-year degree, become a registered nurse. What would you like the young people to know about the education side that they don't know?
I think what's beautiful about nursing is that you actually can start with a 2-year degree. I would not recommend staying with a 2-year degree, but I remember when I made a career move and I was in a situation where, well, I had to feed a family, we had to take care of things, we had a house and children. I knew that I would not be able to go to college for the next 4 years with major expenses coming my way. And so the decision was made to start out at a 2-year college degree level. First of all, the cost of education is significantly lower, but it also allows you to work earlier on in the field and earn money. And then what I ended up doing was getting a 4-year degree with the help of my employer, because my employer subsidized with education assistance. And I did that for my 4-year degree and my master's, and all of a sudden the conversation became a very different conversation, much more affordable, not easier to manage necessarily, because next to life, work, and education, that's 3 heavy sets of balls to juggle out there, but it's doable. And if you plan accordingly, it can be done.
I appreciate that. It's so important for young people to hear that even some of these companies like Spectrum Health, Mary Free Bed, Mercy Health, they pay for your school. So you don't have to have it all to get into the nursing field, that you can start as a nurse tech and let the company pay for it. I was just going to say goodbye to Dr. Jacobus or Dr. Donders. He had to leave. I was just typing a message up to him. And we'll definitely let the students, you're going to have a chance to ask questions. I'm just going to get a few started. And then you're going to be able to ask some questions. So back to you, Chris, physical therapy. What was your undergrad in then too? And help young people understand what are some of those paths to get there.
Yeah, so my undergrad was biology. I actually had a minor in Dutch, but I have coworkers now that had a major in Spanish. I've seen majors in psychology. So you really can do, like Steve said, you can really do any kind of, as long as you get your prerequisites, you can do anything that is your passion. And so, I mean, if history really interests you and you're thinking maybe you want to do something in the medical field, go ahead and take some of those prereqs, and then it kind of opens some options for you down the road. Again, I didn't exactly know what I wanted to do, but so I did take a lot of elective classes. I won't say I decided, but I ended up taking the 5-year college plan because I needed to get some of those extra prereqs later on. But that's something that you can also do. And I took some classes at Grand Valley. I went to Calvin primarily undergrad. But then again, some of those later on classes I was able to do at Grand Valley at a much better cost.
That's great. And so for you young people, I'm not going to spend a ton of time on this next series of questions asking things that I know you can find out by doing some research on the internet. Some of the basics of, how much do they make, and even more things about education and stuff. I want to get to some of their personal stories to help you just kind of gain from their experience and wisdom. So let's go back to, I guess we'll kind of go back to you, Jeannette. Help us understand, you kind of gave a good description earlier, but some of the young people want to know, like, what a typical day is like. What is your day like? So each of you, I know there's probably not this is what happens every day, but let's go through that. What a typical day is for you, Jeannette. We'll start with you.
I'm going to take this as a 2-way approach. If I were a floor nurse, somebody who works directly with patients, I would probably work today 3 12-hour shifts and would be full-time employed. That would be an 0 point. 9 FTE for us, and that would be basically a position, and I would probably work maybe a 7 a.m. to 7 p.m. shift, maybe a 7 p.m. to 7 a shift, and I would be taking care of patients. I would have a patient assignment. I would be, taking care of these patients all throughout the day, helping them with all their care, giving meds, encouraging them, being a partner in their care. Today, I'm not working in a direct patient care role anymore. I serve as a director of interprofessional education in a nursing role, overseeing clinical education. I make sure that whoever goes out there and serves in nursing is fully prepared to take care of patients. So I work today more like like a 7 to 3:30, 4, 5 o'clock day, or sometimes I come in the middle of the night to train people, because nursing is a 24/7, 365 profession. So it really depends on where you serve in nursing. That will dictate what a typical day looks like.
Yeah, and I think this is just an encouragement to young people who are on this Zoom call today, that nursing, what I've learned in my position, it's just such a beautiful umbrella, and there's just hundreds of things you can do with a nursing degree. And even just seeing your progression, with your PhD now, and, being in a managerial role where you're training, it's just an endless journey. So I just want to give a big plug for nursing. But OMP, why should people consider this as a career? What do you like about it, your typical days, if there is one? Share us what it's like.
Well, I really like this career because it's in the medical field and you're really helping people, but you're also working a lot with your hands. With the devices that you're making, it's half of the job is creating the device for the patient. And as far as my typical day, 8 to 5, kind of normal office hours. We have a schedule of patients that are scheduled to come in. Typically for like a prosthetic patient, it's like a fitting for their leg. It can vary from an hour to a 3-hour appointment, just depending on how easy the fit was for the patient, what kind of adjustments and things you need to change with the device. But also it can be a quick one if things go well. But as far as the orthotist side, you can be on call. So if there are emergencies in the ER of a hospital, you'll get called in to fit someone who, let's say they were in a car accident and they need a cervical neck brace. You come in and you fit them with that. Or if they have a fractured back, you go in, and that can be any hour of the night if you're the person on call. So it can be a typical 8 to 5 with appointments, or you can be going in the middle of the night.
Yeah, I think that's important for young people to get that kind of reality, that it's, and young people might like that, like, oh, there's a little emergency room kind of situation, that yep. There's some of that action, Again, physical therapy can be such a broad umbrella too, Chris, whether it's working with athletes or, like you said, in some of the ways that you do it. For your role and what you currently do, you gave us a little bit of idea, but tell us what it's like. And then maybe if you want to help young people understand some of the other contexts that physical therapists work and what they might do each day.
Yeah, sure. As an acute rehab hospital, we're working with some pretty sick patients. My typical hours are 8 to 5, and I would, as a PT, I typically have a 1 hour per patient that I spend. So I'll see 6 or 7 patients during the day. Occasionally they're a little bit longer or a little shorter, but that's pretty typical. And that's a bit different than it might be if I were doing outpatient. So Mary Free Bed has an inpatient and an outpatient setting. The outpatient setting would be for those that are able to be at home, functioning pretty independently, and might need to come in for some additional rehab. Those patients might be seen twice a week or 3 times a week. And again, it could be for some of the same diagnosis, probably a little bit later on in the progression of their rehab. So I've also worked for a home health agency, where we actually would be going into people's homes, and those could be for folks that can't get out of the home for a number of reasons. Could be that they've been quite ill, or could be because they're a little bit older, or they may have been in a really bad accident, and that they just physically can't get out of the house. In that setting, you're going to be again seeing patients all over could be all over West Michigan. You can be driving, which can pose some challenges during the winter, but it also can be a lot of fun. You have a little bit more autonomy over your schedule, which means you can kind of set a schedule and be a little bit more flexible and say, hey, I want to work a 10-hour day this week, and every Friday I'm not going to have any schedule in the afternoon. So you have some flexibility with that. Where if you work in an institution, you're pretty structured as far as 8 to 5. And then all the different therapy disciplines have that, where they could work either in outpatient, or if you're really into sports medicine, you could work in an outpatient clinic that focuses primarily on high level athletes. There are physical therapists that work with professional athletes as well. And then there's also, you could work in a skilled nursing home, which would be probably on the other end of the spectrum as far as, primarily geriatric or really older patients, which every patient population has a draw for each type of each clinician. And so you just kind of have to decide. I had no real interest in working with athletes, and really desire to work a little bit more in acute rehab, or what we'd say geriatric rehab, taking care of more older and sicker patients.
Chris, help young people understand when they have to kind of start making those decisions of who they specialize in. Does that have to happen right away, or is there time to learn through the education process?
No, you have a lot of time. So just like Steve does a residency after he graduates, in physical therapy is a three-year program, and you have residencies, you have internships built in. So you'd have training for about a year and a half, and then you would go out for a short 2-month internship, and you would do every program. School is a little bit different, but you do between 4 and 6 of those, depending on how long they are. So you really have the opportunity to get out there, and the schools are going to encourage you to see something a little bit different. So they wouldn't have you go always to the same type of clinic. And you really don't have to decide what career track after you graduate you want to do until you go looking for a job. And oftentimes, people will change. So I worked in a hospital, acute care in the ICU. I've worked in doing home health. I've worked in skilled nursing, and then I've worked here. So you certainly can move around in different areas.
I really appreciate you sharing that specifically. For you, Stephen, do you have to specialize? Will you have a chance to work outside of a hospital, like a rehab hospital? Tell me, what are some of the varieties that an OMP can take you?
Yeah, it's kind of the same as once you're done with your schooling, the more experience you have in something with like your residencies, you can choose to specialize in certain things, as far as if you want to specialize in pediatric orthotics and you're only seeing kids, the same with prosthetics. Or something that I want to do is, when I'm done with everything, I would like to specialize in upper arm prosthetics. So I will mostly be seeing complex cases of people with upper arm amputations and for their prosthetics.
So you're already starting to find an area that you want to specialize in. That's great.
Yep.
But again, that's part of your learning and exploring, and before you have to nail that all down. Because again, there's so much pressure.
I didn't know that till last year, that I really liked upper arm prosthetics, and I knew I liked the field, but I really have caught on to this, and I like it.
That's fantastic. Again, young people, be encouraged that you don't have to have it all figured out. Okay. We'll go back to you, Jeannette. One of the young people would like to know if there's anything they can kind of be doing in high school to kind of prepare them for some of these type of medical careers. One of them specifically is thinking about med school. But what would you suggest during high school to be doing to prepare for a nurse, Jeannette? And then we'll go. I'll call on the rest of you next.
I think I would tab into my opportunities. So naturally, you can start out with simple things like online research. But what if you have friends in your family that are in those kind of professions that you're hoping to be in? Could you possibly job shadow? Could you link to a local place and figure out what this looks like? Attend career days at colleges, ask good questions, connect with people that are already doing this job, and get an impression. Volunteer for an organization and view view it with your own eyes. Be creative, ask lots of questions. Don't ever stop asking questions. Keep on asking. Eventually, you're going to get answers that will lead you to some pathway that makes you totally happy.
Yeah, I love all those suggestions. And, young people, you're so fortunate with the internet that there's so many great videos of people who are doing these kind of jobs being interviewed. What would you suggest even for them while they're in high school to kind of prepare? Anything that you did specifically or wish you would have done?
Yeah, what I wish I would have done was shadowing and just getting myself out there a lot more in these fields and just getting time and hours watching the profession. I didn't do my first, I guess, internship and shadowing until my degree required me to do it, which was senior year of college. And once I did it, it made me regret not doing it 3 years earlier, just getting my foot in the door in certain places and meeting these people. And just, I feel like on the job, you learn so much compared to just, hearing about it and reading about it. It's just really important to go out and see it.
Yeah, that's why we're so grateful for you guys to give your time during this COVID time to do this even, remotely. It's not in person, they're not smelling it and seeing it and, hearing it there at Mary Free Bed, but to have the opportunity to ask questions of you guys is golden. So thank you again. So Chris, what about for you? Anything that you did in high school, wish you would have done? Any other suggestions for them as they prepare for a medical career?
Well, I think I said that I was involved in a group. It was through the Scouts. I grew up in North Carolina. I also had the opportunity to work in a hospital the summer after high school, and I was a nurse tech. I did patient transport and assisted in a lot of ways, and it was really quite eye-opening. Just being able to realize that I wanted to be part of something right in the hospital, and I think that was really valuable. I just had I knew folks and had just would talk, ask everybody that I knew. And asked about their parents and kind of what they did, and so wasn't afraid to ask questions. So I would second what Jeannette says, is really just don't be afraid to ask and see if you can shadow and try to get out there. And a lot of times the schools, high schools might even have the opportunity to connect you with somebody, and you can spend an afternoon or do something like that. Would be great, just to kind of get more exposure. Being there and smelling it is a lot easier than watching it through on YouTube.
Yeah, and I just want to set a realistic expectation for young people. For most hospital settings, you're not able to really get in to volunteer even until you're 18. There are some really great opportunities though through entry-level positions. For example, in nutrition, you might not think that's a good place to get in, but you can actually get a job at Spectrum and Mercy, and I for sure those two, as a nutrition tech, and you're actually on the floors, you're pushing food to the patients, but you're starting to learn what the different roles are, and you are getting a sense of the environment. So please know that even if you're not old enough to be volunteering there, and the shadow opportunities, we help as the Ken IC, we help get you guys in for things. Once COVID's done, we have a series of programs, but it can be challenging for high school students to get in for job shadows, but it's not impossible. So yes, it's always worth calling and asking. I'm a resource for you now that, once things open up, we can get you back in, but it is so impactful. I've seen it over, time and time again to actually see it. My whole career was based on a one-day job shadow. If I saw something very significant that day, it helped turn me away from something actually, and helped me between my two choices. So I'm a big fan. So we have some questions. One thing young people would like to know, what it's like working in an ICU. So who would like to address, maybe we'll start with you, Chris, those acute cases that, really bad stuff's happening. What's that like? And how do you even cope with that?
Yeah, it can be very difficult. If we have patients that have had a spinal cord injury and could be paralyzed for the rest of their life, that's really big. We have patients that are on ventilators that we're working with them, trying to get them off of that, trying to get patients walking for the first time. I had a patient this past week that had been in the hospital for several months, and was with her family as she took her first steps in the parallel bars. So it can be extremely rewarding. You know, you can start out really low level with some of these patients. They have multiple lines, they may have drains, they may have catheters and IVs, and may not even be eating anything. And just to be able to help them see some small progress can be very rewarding. I mean, for me, that's one of the best things about my job, is just being able to see patients as they progress through many stages in a short period of time. Couple weeks of rehab here, they may go from just being in a wheelchair and not being able to hold their head up, and when they leave, they're able to walk out. They may need a walker, and they may need to continue to have therapy after, or they may need Steve to give them a prosthesis to keep their foot up as they're trying to get up and down steps or something like that. But it can be really exciting to see that progress. But it's very challenging it can be very challenging dealing with life changing events for patients. And we get to go home at night. Unfortunately, they're still here. Nurses taking care of them 24 hours a day, but it can be a very hard place to work.
What are your thoughts on that, Stephen? I know you've been on call and maybe gone to, you know, those kind of critical situations. Anything you'd like to share with young people about that? Because they're kind of curious what's that like to be in an ICU.
Yeah, it can be, sometimes in the room, it can be intense if a lot of things are going on. I've gone into the room and a few nurses are there, the doctors are in there, they're about to do something, and I'll step back. It's not a good time for me to be there because I'm just going to fit them with either their neck brace and whatnot. But if it's something like the ICU, my main goal is to don't cause them pain when I'm applying this brace to them. And so I will often try to time my entrance with, like, let's say the nurse, I'll contact the nurse and find out when they just got their dose of pain medication. So when I go in there, I'm not tormenting them getting this custom big back brace on them. So yeah.
So yeah, that's difficult when you're trying to help and you're causing more pain.
Trying to not cause them pain, because a lot of things I'm putting on them, they don't enjoy putting on. So
yeah. Now, Jeannette, I know you've had a variety of things in your career. Did you have any experience with ICU? Anything specifically you could share with the young people?
I've worked both in the ICU and in the emergency department, one of the most stressful places in the whole healthcare system. And I'm going to smile a little bit with my answer. I'm a little bit of an adrenaline junkie. So that part of my life was really exciting. But I think you learn a quick lesson when you work in either an ICU or in an emergency department. You must be able to discern when the day is over. You must be able to leave that day behind you, because it is stressful. You're seeing death and dying basically in an ICU. You're seeing terrible things, including in an emergency department, things that you can possibly not even imagine. And even so, some people really thrive on that. And I'm one of those people. You have to be able to say, this is where I'm going to leave this today. Otherwise, the burnout is just incredibly high in those kind of positions. So to be able to strike work-life balance, to discern, and to really do good mental self-care is highly important in our stressful situations like that.
Yeah, that's for sure. And I've heard that with folks in the medical teams, that that support they have for each other is so important. Being able to talk some of this through. I just had a quick clarifying question. One of the students, Chris, as far as education for you, it's a undergrad 4-year degree, and then a 3-year program that ends up with a doctorate.
Yeah,
or
currently,
master's, doctorate?
Yes, that's pretty much correct. Yes.
Okay.
There are a few programs that have a combined 3-year undergrad and 3-year masters, but primarily it's probably 4 and then 3 years.
Thank you. One of the students is wondering about your personal morals. Like, does that ever have conflict at work? I'm not sure what they were thinking specifically, but any thoughts come to mind around your personal morals and them conflicting with your job?
This is Jeannette. It's funny that you asked that question. Yesterday, I was interviewed by a student from a local college on ethics in healthcare. And that really is exactly a perfect question that somebody here in the room asked, because we face those challenges every day. If I have to take care of somebody who yesterday possibly murdered somebody in society out there, and he's a prison patient per se, I'm going to possibly struggle with some of the things that I have to do, right? What if I work in the emergency department and I have to deal with abortion issues, but I personally don't believe in those kind of issues? So there's ethical issues every day out there in healthcare. You have to be able to be very, very neutral and not judge and not imply your own values, because that's not acceptable. We will meet and walk with people from all walks of life, whether that is a situation that's related to religious beliefs, sexual preferences, maybe cultural differences. We are not allowed as healthcare workers to be judgmental. We have to be able to treat anybody who comes into our system at the highest level of care. And we will be facing those kind of challenges. We will be working through those kind of questions.
Yeah, that's great feedback. Anything for you, Stephen, that you would want to add to that?
Yeah, I would probably just add that I feel really fortunate to work for a company like Mary Free Bed, because it makes it pretty easy as far as morals. The first day of my residency, we met with the CEO of Mary Free Bed, and he basically told us to always put the patient first and do what's necessary for the best care of the patient. And I know some companies might not do that, where if there's an orthotic or prosthetic option that's cheaper for the company, they'd like you to pursue that, even though it's probably not the best option for the patient. Whereas here at Mary Free Bed, they want us to be doing what's best for the patient, what's going to give them the best outcome. So far, it's been pretty easy for me as far as having any kind of moral issues.
Yeah, and I think that you bring up such a good point that as you go into different workplaces and work settings, that not all companies have the same ethics. So that's a really important thing to make sure that aligns with you, because it's really hard to get out of bed on Monday morning when you're going to be conflicting. Chris, what would you like to, anything to add to that conversation?
Well, I guess I would also say that sometimes we have to take care of a patient that may have been in a car accident, and they could have been they could have caused an accident that killed someone, and so that can be a challenge to have to deal with that. Sometimes we have situations where other family members are injured. So really just trying to provide compassionate care, irrespective of kind of, if you know anything more about the situation. We get gunshot wound patients here, and so there's just a wide variety. Other place where I worked, again, we had to work with prisoners, and so yeah, I mean, just really treating every patient with the dignity and respect that they deserve. Kind of leaving their previous life when they come in. That doesn't really matter what was going on with them before. I'm just kind of treating the patient as they are now, and really trying to get the best outcome for them. So I think that, as Steve said, I mean, we don't have, there's not a push at Free Bed to go a certain direction, but we really have to kind of do what we have, our own moral compass to kind of help direct the way that we treat and respect our patients.
Yes, because this field really is all about customer service, right? You have to have a high value of people and giving them the best outcomes. So for young people that doesn't align with you, these are some of those experiences that will help you start to discern, maybe this isn't for me. One of the students was wondering, did you ever debate between two different fields? And then how did you decide? Like you had mentioned, Stephen, that there are people who are engineers that now came into medicine. This young person, it sounds like, maybe has a interest in law and medicine. How can some of these things come together, or how do you decide on one or the other? If any of you would like to share kind of that decision-making process you went through, we can start with you, Stephen.
Yeah, so I initially went to college with the idea that I wanted to be a physical therapist, and I went for 2 years, and I liked it. I had shadowed a bit, and I liked it, and not until I met with the advisor and I learned about orthotics and prosthetics, and I found this field where, growing up, I've always worked with my father on hands-on things. We would build a lot of things, and I found this job that kind of was a bit of a perfect mix of the two. I'm working with patients, I'm helping them get up and walking again, but I'm also figuring out these devices and building them and giving them their way of lives back. It was for me, and I really like technology right now, and the field has a lot more of that in it with microprocessor knees and hands and ankles now. It was a perfect mix for me and the things that I wanted. So I was able to kind of take what I thought I wanted with physical therapy and then build it with the other interests I like to do this field.
Yeah, I think that's such a good answer too. For young people, you probably don't realize how many two different interests can come together. There's so many jobs where they blend, whether around ethics, you know, for example, you might like law and health, but then you end up in the ethics area because there's some similar values to that. How about you, Chris? Anything you wanted to say about kind of deciding between two things?
Yeah, I actually, for a little while, I was quite interested in biomechanical engineering. So looking at developing artificial lungs or artificial hearts, and they just have a lot of new valves. There's a lot of technology in that. Then I realized that there was a lot more math and engineering in it than I really was interested in. So I didn't really like calculus, and beyond that, I just figured that's not the right area for me. The reason that I chose PT over medicine straight as a physician was I really felt that you had a little bit more control over your hours than you do as most doctors, and then you really get to spend more time directly with patients. And so being able to spend an hour with a patient one-on-one, or with a family member, or with a tech, just spending that whole hour working with them is much more. It's a much longer process than you get than the physician does. So the doctor comes in and kind of checks on them and says, "Oh, you're doing great," and listens to your lungs, and I mean, well, then they do all the other stuff that they don't do with the patient, taking care of medications. But we get to spend a really long time really getting to know the patient, developing the rapport and developing that relationship. So it's very, very rewarding in that. And so that was the reason that I went in the therapy direction. There's less on call. You have the opportunity to work some weekends, and when I worked in acute care, I would get called to the emergency room to help a patient with maybe getting some crutches or a walker, or kind of deciding if these patients needed to get admitted. But it's not in the middle of the night they're getting called for a physical therapy consult. That can usually wait to the morning. So that's a little bit better for some work-life balance as well.
And that's such a great topic for young people to be aware of. That's the reason I was working with a client, and she was looking at accounting, but then and because of the work-life balance, decided to go into being an actuary. So they're very similar work, but the life, family balance is different. So these are the things, young people, I want you to start thinking about as you go through these years of high school, is to start learning so you can think, oh, that would fit my personality, or that I like the idea of having my weekends off, or I don't mind if I work weekends. That's cool. You won't know until you start to research and ask these kind of questions. We're running out of time. We have about 3 minutes left. And so for some of you guys that are asking questions about education, I'm going to encourage you to go to some of the career websites, and I'll share one with you at the end here to get a little more information. But for some of you, did the years of education make a difference in your choice? Like, I don't want to go to full on med school, like, Dr. Donner had to. I could get this done in 6 years. Is that a factor? And I know for you, Jeannette, we'll start with you. You started with a 2-year degree, then you got your 4, then you got your master's. Again, you don't have to have it all figured out right now, do you?
I didn't. And I saw in the questions, somebody is asking here, what it means if an employer furthers the education. So I started with a 2-year degree because it made sense for my family. That is what I could manage financially, and that is what I could manage with my family. And I knew I wanted to work quicker, earlier, so that I could bring money in for my family. So in regard to tuition assistance, depending on where you work, your employer may offer you tuition assistance out there. And that's really dependent on the employer. Some programs offer a lot, some offer a little less. Don't let that discourage you. You can take one semester, a class a semester. You don't have to finish everything in 6 months and passing. Stretch it out if you need to. If you need to financially stretch out, then stretch out. Nobody says that 4-year degree, that master's degree has to happen in the next 18 months. It could take you 2 years. It could take you 3 years. Most colleges go up to 5 years. I'm not suggesting that, but if you need that stretch financially and personally, plan wisely and figure out when is the best time. I didn't take summer classes. I wanted to be home with my children. I didn't take a class right around Christmas time either. I took 6-week classes because that made sense in my life, and I grouped them so that they made sense for myself and my family.
Thank you. And I am aware of the time, you guys. It's 4:29. So if you need to leave, Chris or Stephen or Jeannette, I understand. I just want to finish off with a word of wisdom. That's really just how I like to close out.
I'll just also say that we've had several rehab techs that have worked at Mary Free Bed. So you get some on-the-job training, and you may be assisting with a therapist with following with a wheelchair. You may be helping on some equipment, and some of those staff, they have either started their college, they've done a little bit. I don't know if you even need anything more than a high school degree. You can do that, and then a lot of them will then kind of decide, hey, do I really like this? Do I want to go on? Do I want to become a therapy assistant, or then do I want to kind of work here again part-time and then continue to get on to go back to college or get my degree? So there are ways to get a little bit of exposure, even and still getting paid, and then continue to decide what you want to do, and then go on from there.
Very great. That's wonderful. How about you, Stephen? As we finish out, just a little word of wisdom.
Yeah, I know there are a few different career paths that you can choose in orthotics and prosthetics that you could do before fully committing and whatnot, kind of getting a feel for the field before jumping into the schooling aspect. Is I'm pretty sure with just a high school degree, you can take a course to become an orthotic fitter, and that gives you the ability to fit patients with orthotics that are not custom made to the patient, more just like prefabricated items. Or there are technicians in the field, orthotic and prosthetic technicians, and those are the people that actually are in the back of in the lab making the devices. I was actually a prosthetic tech for 2 years between my undergraduate and master's, and that just gave me a good 2-year preview if I wanted to do this and be in the field. And it was a huge experience for me, and I really like that.
I think that's the best practice. Whenever you can get into the field as an assistant, as a technician, as one of the support people, you just get such a feel for it. It's such great wisdom. Jeannette, you're going to close us out. Any words of wisdom for these young people?
I would say, don't be afraid to explore. Don't be disappointed if something doesn't work out. Just remember, the sky is the limit in nursing. You can do it. If you find that something doesn't work, look for the next best thing. Just be true to yourself, and most of all, be true to your patients. You're there to serve. You must serve well. That's probably my only ask of you. If you switch around, that's okay, because we all have to figure out who we are at the end of the day. And our opinions and choices will change over time as we grow older, as we get more experienced. Just remember one thing: if the patient is the center of your care, treat your patient well. Watch always out for the patient.
That's a great way to end it. It's all about the patient, for sure. The students are very thankful. Lots of thank yous going in the chat, you guys. I really appreciate you making time. This is so valuable to them, especially during the COVID time where they can't get out and job shadow. These students are, still need to learn this stuff. So thank you for making time. I appreciate it. Everyone, you guys have a good afternoon. We have, for the young people, we have a career chat on Thursday afternoon at 3:30. So go to kentisd.org/career chats if you aren't part of the immersion program. All right. Thanks, role models. Thanks, everyone. Oh, Shamil, I didn't get you to talk. Shamil, I'm sorry. Oh.
No, it's okay.
When we were talking about the volunteering, I'm like, oh, I got to have Shamil. And then we just kept going.
I thought we were on until
It's
5
okay.
o'clock.
You know, we've had that in the past, Jeannette, but for the young people, they have so much online that we have found that an hour is good. Otherwise they get a little
Got
too
it.
zoomed out.
Okay.
Shamil, next time we're starting with you. That's just how it has to happen.
Okay.
And you're the sick
Alrighty.
child and you've been sitting there listening to your colleagues. Ay, ay, ay.
Yeah, no, I like just sitting here because I don't often really get a chance to hear everyone's story. So it's fun for me to hear everyone's background too.
What I will do though, because I have the registration names for this session, is to send them an email tomorrow with your name and contact information, just about for volunteering.
Okay, awesome. That sounds great.
Is there anything else you'd like me to add to that email?
Nope, that is all.
Okay.
Yeah. Now the next one, I actually probably will be on maternity leave for the